Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today I'd like to talk about IUDs. There is so much reference information available that I'm not going to give you all of that detail. You can look it up, you can Google it. I'm trying to give you my 30 years of experience, my recommendations, and try to put context into what's the benefits and the risks, what are exaggerated risks and what are real. Overall, I have to tell you, I'm a big fan of the IUD. It is very effective, very safe, and most of my patients are very pleased with IUD. I have put in thousands of IUDs over the last 28 years and more. I would say 99% of my patients are really happy with them. And about 1% don't like them and write bad things about them on the internet. Isn't the internet a complaint box? So one of the benefits is, well, let's talk about the different types. There is progesterone containing, and then there's copper. So you have the Paragard, which is copper, it lasts 10 years. You have Mirena, Kyleena, Skyla, Liletta, perhaps others. They all have progesterone, different sizes, different amounts. I would tell you that I like the progesterone containing ones. I find patients much happier with them. Let's go to the Paragard. I won't spend too much time on that. I have put in many of them over the years, initially until the progesterone containing IUDs came out, and the satisfaction is so much higher. So basically the Paragard lasts 10 years, but you still continue to have periods, and some women have heavier periods than before, but there's no decrease in the intensity of your periods and the cramps with the IUD, the copper IUD, for most women. There are always exceptions. The one thing I like about the Paragard is the string is softer. I wish the other brands would use that, and we'll get into the reason for that. But basically, overall, you see for that copper IUD, you see an effort to say it's non-hormonal, and someone will seek that. But the amount of hormone in the IUD is so small, the progesterone containing, that it really just has a local effect on the uterus and really doesn't have systemic effects throughout the whole body to any significant degree. It's such a tiny amount. So for example, it doesn't give you acne, it doesn't help with acne, it doesn't make you gain weight, it doesn't help you lose weight. It just has no effect. Neither of them do. Depo-Provera is the shot. It's the only birth control pill that's been clinically shown to promote weight gain, and that's because it increases your appetite. But that's not the IUD. Hope I can be clear on that. So Mirena and Liletta are the two large IUDs that Mirena has now been approved for 8 years. It used to be 5, it went to 6, 7, and 8. Liletta, I think, is to 7. They're very similar, but Mirena's been around longer. I prefer the placement of the Mirena. I've done them both. They're both great. There's no big enough difference. I've just put in so many more that I like to place it as a physician better, but I would say that they're pretty similar. The Skyla is only for 3 years, and it's the same size as the Kyleena, so I wouldn't bother with the Skyla anymore. Kyleena is only 5 years. It's 80% of the size of the Mirena, same company. And probably a good opportunity for teenagers or women who've never had kids, who have a small cervical loss, give them that opportunity. Potentially a little easier to place. Not quite as good at stopping periods. So let's talk about stopping periods. The Mirena IUD and the Liletta significantly reduce bleeding. These are approximate numbers. 80% less bleeding in 3 months, 90% less bleeding in 6 months. That's pretty impressive. I know very few women who aren't pleased with that dramatic decrease in their bleeding pattern, and which is one of the huge benefits. You hear about perforations. Of course, that's the biggest complaint. I can tell you I have never had a patient of mine have a perforated IUD. the IUD perforated. Now, I have had 3-4 women sent to me with a perforation, and the surgery to deal with that is the same surgery as getting your tubes tied. It's a laparoscopy. So I have not noticed any serious problems. Look up, there are potential, but they're super, super rare. There are some women who cramp more with the IUD. There is a potential for it to change positions a little bit, and I haven't found that to be too significant, though data seems to say that it can happen not a trivial amount, but for the vast majority of my patients, it hasn't been a significant problem. The most common problem is the IUD string. About, I would say, in my experience, 10% of women come for their follow-up visit and say, my boyfriend or my husband feel the string. The string is a little bit firm. It softens up, but at first it's almost like a little thin fishing line, and partners can feel it. The string, if this is the cervix, sticks out. It's supposed to curl around. Sometimes it doesn't. We can then just trim that string, and then both partners are happy. However, when it's time to remove it, we pull the string. So if it's trimmed, it can be a little bit more difficult. I've only had one out of many, many patients. I trim it probably once a month, where we had to take them to the operating room to remove it because we couldn't get to the string. But it's a small issue. That's what I mentioned about the Paragard having a nicer string. It's softer, and we have less complaints of that. But overall, the satisfaction and the effectiveness ranks as high as it is. It can be arguably better than getting your tubes tied or a vasectomy as far as effectiveness of preventing pregnancy, and it's reversible. So I do have another video discussing getting your tubes tied versus using an IUD, but I encourage women who want the absolute best method to prevent pregnancy. That would be a progesterone containing IUD is most effective at preventing pregnancy. Does it cramp? Well, if you've had a baby, most women don't even notice me placing it in, especially if it's postpartum, right after having the baby. If you haven't, if you're a teenager, it can be just uncomfortable, but most do fine, and the cramping subsides in 2 to 3 minutes. Some cramp for 2 to 3 weeks, but most it's really intense before. There are some ways we can decrease that. I encourage women to eat before coming to get their IUD so they're not hungry, and if they're concerned about the cramping, to take some Aleve, ibuprofen, Advil, Motrin 1 to 2 hours before. One thing that's brand new that I'm not a fan of, and that is immediate postpartum placement of IUD. That's putting it so that patients don't get lost and to follow up and come in pregnant, just putting it like at the time of a C-section or after delivery. I think that's a big mistake. They quoting rates as high as 30% falling out, and that is unacceptable to me. But I don't make the rules. I'm just giving you my opinion. Wouldn't have any of my family members have that right afterwards. I think it's a mistake, and I'm betting it'll go away pretty soon, but who knows. So I hope you found this information useful. I'm going to provide some hyperlinks. It's not an exhaustive, detailed review of the risks and benefits, but rather an overview of my experience and why I encourage it, and encourage you to discuss it further with your physician and to look for some of the links to get more information. Thank you.